Very good afternoon. This is Dr. Snehi Mishra, and today I am here with a new video on facial nerve. So in this video I will talk about the facial nerve anatomy and the function of facial nerve. So the facial nerve is also called mixed cranial nerve because it has motor function, sensory function and parasympathetic function. The motor function of the facial nerve is it gives motor branches to the muscles of facial expression. Sensory function is like of two types. It carries sensation of taste from anterior 2/3 of the tongue and this general somatic sensation from the posterior part of external ear, and parasympathetic function is for lacrimation and salivation. Okay, so now I will show you the course of facial nerve. Okay, so the facial nerve function is motor, sensory and parasympathetic. So first I will explain the course of motor fibers of the facial nerve. So the nuclei of motor fibers of the facial nerve are present in the lower pons here. This is main motor nuclei of the facial nerve. The fibers originate from here, then it moves backward toward the fourth ventricle, then it take a turn and exit it then it exit at pontomedullary junction. From here the fibers passes and enters inside the internal acoustic meatus. Here there is a lateral geniculate body. The fiber does not pass through the like synapse with lateral geniculate ganglia. It just enter into the middle ear. This is middle wall of the middle ear. This is anterior wall. This is middle wall of the middle ear, and here it passes. There is a tube, there is a canal inside the middle ear. The motor fibers of the facial nerve passes inside this canal horizontally on the middle wall of the middle ear, then it passes vertically. It comes out from the ear, this point, the sternomastoid foramina. Posteriorly there is mastoid process, anteriorly there is styloid process. It comes out at stylomastoid foramina. It gives supply to the posterior belly of digastric muscle, one branch, one motor branch, and then here it jumps into the parotid gland. Here it gives branch to, it gives 5 branches basically. Temporal branch, zygomatic branch, buccal branch, mandibular and cervical. Okay. So in parotid gland it gives 5 motor branches. These all 5 muscles supply to the muscles of facial expression, and here inside the canal it gives 1 motor branch to stapedius muscle. Muscle which control the excessive vibration of stapes bone during loud sound. So it is giving 1 muscular branch here to the stapedius muscle, to the posterior belly of digastric, and inside the parotid gland buccal branch, mandibular branch and cervical branch. Now I will tell you which all muscles are supplied by all these branches. Okay, these all are the 5 branches: temporal, zygomatic, buccal, mandibular and cervical. This I will tell you later on. Branches: temporal branch, which is uppermost branch, supplies the frontalis, orbicularis, oculi, corrugator supercilii and procerus. Now this is corrugator supercilii here. This is procerus muscle. This one is frontalis, which is part of occipitofrontalis muscle, and orbicularis oculi. The function of frontalis is it pulls the eyebrows here in upward direction, and it works during surprise action. When we are very much surprised, at that time frontalis work. Corrugator supercilii, it pulls the skin medially and downward. So corrugator supercilii is helpful for frowning. When we do the frowning, the corrugator supercilii works. Orbicularis oculi, this is responsible for closing of the eyes. Orbicularis oculi. And the last one is procerus. Here it is present. I will show you the picture. This is procerus. This is pyramidal shape structure. It is responsible for making a bridge, making wrinkle over the bridge of nose here. This frowning action is this one. This action is done by the procerus muscle, and basically when we smell something, so procerus acts and make a wrinkle over here. Next part is zygomatic. So zygomatic basically supply the zygomaticus major and minor. These two muscles are called smiling muscle. This is zygomaticus major. There are two here. This is zygomaticus minor. Zygomaticus major basically moves the angle of mouth in upward direction. Zygomaticus minor basically elevate and evert the upper lip. This moves angle of mouth upward. This elevate the angle of mouth. Zygomaticus minor elevate and evert the upper lip, but both are smile muscle. This action is done by the zygomaticus major. Dimple occur in zygomaticus major. This action is done by the zygomaticus minor. Now, the buccal division of the facial nerve, it gives supply to the buccinator and superior part of orbicularis. The orbicularis oris present around the lip, and it helps in closing of the mouth. It is also known as kissing muscle. The buccinator muscle help in making the fish face. Next is fourth is a marginal mandibular branch, which supply to the risorius, mentalis and lower part of orbicularis oris. The action of risorius is also smile. It pulls the angle of mouth laterally. This is risorius muscle. So it will, when it will contract, pull the angle of mouth laterally. This action is done by mentalis. It is also called muscle of doubt. It protrude the lower lip. Last division is cervical, which supply the platysma. Platysma works it basically draws the mandible downward, and it is working basically when like there is grimace expression on the face. These all are the muscles: frontalis, procerus, orbicularis oculi, zygomaticus minor, zygomaticus major, buccinator. Okay, the next is parasympathetic function. For the fibers of the parasympathetic, this one, the facial muscle parasympathetic fibers originate basically from the superior salivatory nucleus, which is also present in lower pons. From here, the fibers moves. This is parasympathetic fiber, passes through the internal acoustic meatus, and from here they jump into the middle cranial fossa. In middle cranial fossa, there is a foramina lacerum. This is foramina lacerum. The parasympathetic fiber of the facial nerve, which is responsible for lacrimation, passes through the foramina lacerum. Here there is a plexus. Here it passes with sympathetic fiber, which is coming from a plexus around the internal carotid artery. Then these both nerves enter into the pterygopalatine fossa. This is pterygopalatine fossa. There is a pterygoid ganglia. This parasympathetic fibers ends here, preganglionic fibers ends here, and postganglionic fiber starts from here and reach to lacrimal gland. So now this part of the fiber which is coming from here, this is called greater petrosal nerve. This sympathetic fiber is deep petrosal nerve, and here they are these two fibers moving inside a canal. This is called pterygoid canal, and the nerve is called vedian nerve, and this is parasympathetic fiber reaching to the lacrimal gland responsible for lacrimation. I will again repeat this. The parasympathetic fibers responsible for lacrimation start from the superior salivatory nucleus in pons. They comes out of the brainstem, enter inside the internal acoustic meatus. Then they jump into the middle cranial fossa. Here this part of the nerve is called greater petrosal nerve. Then they enter into the foramina lacerum, where it combines with sympathetic chain which is coming from the plexus. Then this sympathetic chain fiber is called deep petrosal nerve. They both of the sympathetic and parasympathetic fibers passes through a canal which is called pterygoid canal, and finally they enter into the pterygopalatine fossa, where the parasympathetic fibers ends on the pterygoid ganglia, and post-ganglionic fiber moves to the lacrimal gland and responsible for lacrimation. This now the next is the fibers for salivation. So from here this parasympathetic fibers are going. Here the parasympathetic fibers of the lacrimation moves into the middle cranial fossa, and fibers of the salivation get separated and enters inside the canal, moves horizontally, vertically, and then it jump into the cavity, and then from here it comes out, exit from the ear and comes inside infratemporal fossa, where this preganglionic fibers ends on join with the ganglia. Then this postganglionic fiber reach to the sublingual and submandibular gland which is responsible for salivation. So how they are going? From here the preganglionic fibers for the lacrimation and salivation are moving, and at this point the lacrimation goes into the middle cranial fossa, and the fibers responsible for salivation comes into the ear, passes through the canal, and finally they jump into the ear, and from the ear they jump into the infratemporal fossa, and where they join with the submandibular ganglia, and from the ganglia the postganglionic fibers move for the submandibular and sublingual gland of salivation. Okay. The next is two-part, motor part and parasympathetic I have explained. The next part is sensory. In sensory also two portion is there, sensation from the tongue and general somatic sensation. So first I will explain this one. So the fibers for the taste originates from the tongue. They moves in infratemporal fossa along with the lingual nerve. They enter inside the ear, and finally they enter into the canal, and then they passes